guys, it's Dr. Vemula here. I am a double board certified plastic surgeon here in West Long Branch, New Jersey on the beautiful Jersey Shore. Today I was going to talk about common questions people have for a tummy tuck. So one of the most common questions I get asked is, what is a tummy tuck? So a tummy tuck, also known as an abdominoplasty, is a procedure to remove excess skin in the lower abdomen. So this usually happens after massive weight loss, after pregnancy, where the skin doesn't spring back. Women have excess skin in the lower abdomen, and we do a surgical procedure called an abdominoplasty, or commonly referred to as a tummy tuck, to remove the excess skin and also to tighten the muscles, the rectus muscles, which are also called the six-pack muscles, to restore a pre-pregnancy abdomen or a pre-weight loss abdomen. Another great question we always get asked is, who is a candidate for a tummy tuck? So anybody who has excess skin in the lower abdomen is a good candidate. Also, someone has to be stable with their weight, have an acceptable BMI, or which is called a body mass index of less than 30, be done with childbearing, and done and stable from any type of weight loss that's done medically or with surgery. So since we just talked about who's a candidate for a tummy tuck, let's talk about who's not a candidate. Anybody with severe medical problems that precludes them from any elective surgery, such as cardiac problems, lung problems, also people who are uncontrolled diabetes, who are smokers or have any exposure to nicotine, including vaping, secondhand smoke. A person who's not a candidate would be someone who's not done with childbearing. We don't have to do the operation twice. And if you're currently losing weight, we'd want you to be stable with your weight for at least 3 to 6 months before considering the procedure. So plastic surgery, especially a tummy tuck, is highly individualized, and there's no one-size-fits-all solution. So there are different types of tummy tucks. The most common one is the standard tummy tuck. That is where an incision is made from hip to hip. The excess skin in the lower abdomen is removed, and we do a little bit of liposuction on the flanks, also called the love handles. That procedure takes about 2.5 to 3.5 hours. Another type of tummy tuck is called 360 liposuction with the tummy tuck, where we do liposuction at the back. That takes a little bit longer. Another type is called the fleur-de-lis tummy tuck, where there's excess skin in both the horizontal and vertical direction, so that involves an incision that goes up and down in the midline as well. Another popular type of tummy tuck we've been doing lately is called the scarless tummy tuck, which involves liposuction through very small incisions that heal very well, and we use Renuvion or J-plasma to tighten or contract the tissue beneath the skin, which can give the appearance of a tummy tuck for if you're a candidate. So an important aspect of going through a tummy tuck is the recovery. That's a very common question I get asked. So it's a same-day procedure. You come into the hospital or the surgical center the morning of surgery. You go home the same day. I see you in the office the next day after surgery. And the recovery is 6 weeks until you are fully recovered. So that doesn't mean you're invalid for those 6 weeks. Most people can drive after the first 10 days to 2 weeks. You could do non-impact aerobic activity, like a light walk on a treadmill at 4 weeks, and light impact aerobic activity like lifting 1 or 2 pound weights at 5 weeks, and at 6 weeks you're fully recovered, no restrictions whatsoever, and you can even go skydiving if you want. So another very important question I get asked a lot is, okay doc, what's this going to cost me? So with an abdominoplasty or tummy tuck, unfortunately, it is normally not covered by insurance if done just for cosmetic reasons. So the costs associated with the tummy tuck are my surgeon's fee, the operating room fee, and anesthesia fee. And exactly how much depends on the type of tummy tuck you're getting and the length of the procedure. Our patient coordinator can go over all that in detail when you come for your consult. So you're probably nervous about coming in for your consult. That's absolutely normal, so let's talk about what to expect. So from the moment you come to our office, you'll be greeted by our wonderful staff, and you'll be taken to one of our exam rooms. I meet with you personally, go over your full health history, then go over what exactly your concerns are. After that's done, we step out for a second, let you get changed into a gown. We take pictures of areas of your concerns. I come back in, examine you, then I go over what procedures would be good to achieve your goals. So when researching a plastic surgeon that performs abdominoplasties or tummy tucks, a lot of people have choices, and people often ask, why should we come to you? Well, with me, you'll always get the highest standard of safety. And if you come to my office or you talk to my staff, you'll always hear that I say, like a broken record, safety above all, patient safety above all. So when you come to my office and come see me for a tummy tuck, you'll know that you'll get great results, and I always have the highest standards of safety, and I do your surgery from start to finish, and I'm with you every step of the way.